My name is Nara Murillo. I'm the host of Agewell Avenue podcast, and my co-host is Barbara Slingloff.
On this show, we talk about navigating healthcare, housing, investing, and advocating for our seniors.
In our last podcast, Nara, you were sharing about your experience at St. Joseph's, and after sharing that, you mentioned that you then moved on to NAMM. So why don't you share with us about your experience at NAMM?
Sure. So NAMM is actually, it stands for North American Medical Management. And I actually got another opportunity to be in leadership. And so this was another supervisory role. And what I did was I had managed 3 medical groups along with reviewing, and I had a nurse who was reporting to me as well, who was doing a lot of our concurrent review in the hospital. And so, I had one coordinator. So it was a lot to manage for one person, to say the least. And my duties were basically doing rounds with the medical directors for the 3 hospitals, along with my nurse. And also, I used to run the UMC meetings, utilization management meetings, along with our medical directors and basically the team, provider relations, and um, everybody from the management team. And I used to run reports for that and just getting prepared to basically present how we were doing and what were some of the cases we were having challenges with, and what can we learn from that and how we need to approach it next time when we have things like this occur. Also, I used to do a lot of the work plans for the medical groups. So basically, it's the health plans letting us know that there are certain things that we need to work on, and what are those things that we need to work on, and also how we're going to be tackling that and improving basically. Um, I also attended managers meetings, which was NAMM had a lot of different medical groups. So it was different management teams for the different regions. And so we used to attend once a month meetings there at the main office. And so we used to meet with everyone and also kind of go over, some of the challenges, what are we working on, as far as employees and what open positions and things like that. So it was kind of a mixture of a lot of different things we would discuss. Um, and I was also covering my nurse when she was out on any type of leave, or she needed some time off, vacation, whatever that may be. I was the one that was covering her duties as well. So um, it almost felt like sometimes it was a one-man show, a lot of times. And so, but eventually, I felt that I actually asked my manager at the time to, provide me with some support. And he wasn't very welcoming of that. He would just basically say, he would just direct me to different management teams, ask for this manager to help you or ask that supervisor to help you. And I just felt that that was one of the things that I saw, and that was just poor leadership. And I should not have to be told to go to another supervisor or another manager to provide help for me. And I did some research, and based on the number of people that I had in each of my groups that I was managing, I was technically able to hire another nurse to at least review for me. So at least I would alleviate some of that for me, because I remember I was starting work at 4 o'clock in the morning, and sometimes I wouldn't end until like midnight. And I realized that that was just not sustainable for me. And, based on management not giving me the support I needed, and I just decided to basically leave. And I had another opportunity to work with you again. And this time it was Golden State Health Plan. And it was just it was very exciting for me because of everything that it stood for and what it was supposed to do for the senior community. I was just super excited about that. And so to actually take on a role and, working on appeals and grievances, and then the management side of things, and I was promoted to manager and kind of overseeing things between even just customer service and a little bit of kind of everything that we used to oversee, and you being kind of the director and navigating all of that was just, even though it was so much work, right, as we were going through a lot of different changes and trying to run a pharmacy, and doing all of the different, trying to build a new system and everything else. It was, even though it was a lot, it was just so, I felt like it was so rewarding because of what we were doing, right, helping these seniors out. Do you have anything to add to that, since you were there as well?
I think that particular experience, the excitement of that was having all the other lenses from all the other experiences, that when you work for a health plan, that is a different lens that you look through, and your ability to impact and make a difference in patient lives. For those people who don't know how utilization management is structured, when you work for a medical group or a medical management company, there's a number of them. So basically, all of the health plans, they're responsible for all their members, everyone that signs up, and they can delegate the care of those members to delegated entities, which can be medical groups, IPAs, medical management companies. And so this auditing piece and work plans come from the health plans overseeing whoever they delegated that work to. So those companies get paid by the health plan to manage their members. And so there's a pretty strict audit piece. But when you actually work for the health plan, you're really getting a chance to weigh in on how members are cared for. And since we came with other experience from the other side, I think we felt that it was really, I know I did, I felt it like it was a real opportunity to make a difference and to be that health plan that really provides and cares for their members, not just provide the care, but care about them. And that we could do a good job and work hard at creating something where the patients felt cared for.
Absolutely. And I think when we had the opportunity to work with Epic at that time, right? And going to their headquarters in Wisconsin and learn and understand how we can build what we really wanted to build, right? For our members. And I think that experience was, I will never forget it. It was one of the most impactful experiences, I would say.
And Epic is a EMR, an electronic medical record. It's very well known. A lot of hospitals, physicians, a large number of people are starting to use this EMR. And so having the opportunity to look at how things are coded and built to be specific, to do specific things, to collect specific data, to really enhance not just the providers and the healthcare institutions, but also to be an experience for the patient or the member that they have software where patients can track their own lab work and appointments and email doctors and ask questions and really um, provide some autonomy for the patient and feel like they can take control of some of this as opposed to waiting for results, waiting for a call, waiting that they could go and to their patient portal and be able to see their information and track the results.
Yeah, and also the fact that he was also building, the company CEO was also building genomic lab, right? So we were going to be having that as well, and that was exciting with all the different newer things that he was able to do, and the new ways of testing, and so I think that was another exciting component, understanding and kind of having firsthand seeing all of this kind of um, you know uh, come to fruition. Let's just put it that way. And I think that the other piece was that we got a chance to really experience was the company culture and how we were going through some training with, I think it was the Ritz, right? Was it the
Yeah,
Ritz
the
at
Ritz Carlton.
and then also Disney, right?
Yes,
Yeah. So we were
those are
basically,
those are two companies that are well known for their customer service. They're top at their game.
yeah, yeah. And just for us to learn and how to interact with each other and also with our clients, right? With our seniors, with our population. And so I think that it was really interesting to see and go through that experience as well. But I think the most rewarding for me was that not only that we were able to really build this software that could really help and impact these patients, but also I think for me it was because I was doing a lot of the grievance and appeals. I think that for me, the most impactful what part was being able to look at this from a different perspective and also advocate for a lot of our seniors and understand that and even though I think I had a little bit of both where patients were really trying to kind of bend the rules a little bit, if you want to say, you want to put it that way, but also I think that it was just rewarding to know that they had someone that was, you know, looking at looking out for them as well and advocating for them as well. So I think those were some of the things that I really appreciated, and I think a lot of, because there's so many layers, a lot of people don't understand that whole process and how it works, and how it's different layers, right, on the process of grievance and appeals. So when you have the medical group involvement, the medical group says no, you may not have this service, right? And so then it comes to the health plan, right, for the health plan to view that and say, okay, yes, we are in agreement with the medical group, or no, we're not in agreement with the medical group. So at that point, if we say, yes, we're in agreement with the medical group, then the patient can pretty much say, well, I still don't agree with you, right? I can take this to another level, which is basically a completely different company that reviews this, right? And so it has absolutely nothing to do with the health plan or the medical group. It's a third party that they have no content to any of it. They're just looking at the paperwork and looking at the information and making a determination. And it's the same thing for, let's just say, if we did not agree with the medical group and said, no, we don't agree with the medical group. We believe that, based on this guideline, you may receive this service. At that point, we already basically overturn the medical group and we pay for, or we approve for that service to be rendered, right, to this to our patient. So I think a lot of people don't understand those levels. And I think that it's very important to understand how this works, because I feel like nowadays I see so much of that in a different light, right, than back then. And so I think that people are just, obviously understanding and evolving and reading and, doing a lot more of that these days. So, but I think that was one of the biggest things for me when I was working there. So I really love that.
We learned a lot, and in a short period of time, considering all the ground that we covered and the people that we were working with and how well we worked together as a team. Everybody worked hard, everybody pulled together. And I think when you're building your own culture, it's different than when you show up to a company who already has a culture and says, here's where you have to align yourself, as opposed to contributing to what you want to align yourself to and what mattered and what was important, and pulling all those thoughts and ideas together to say, here it is. So that was those opportunities don't happen very often. In a startup, yes, you will always have those opportunities to build culture, but we were fortunate enough to really have many different experiences that we probably wouldn't have had and hadn't had up until that point.
Absolutely, absolutely, and I think I'm hoping one of these days that our medical director, which I absolutely loved, I think he was amazing at what he did, and he very much aligned himself with what we believed in, and that was just such a breath of fresh air to be dealing with someone like that. And hopefully one day he will come on our podcast and join us for an episode. I'm hoping. So I'm hopeful, and I would love to have him on for sure.
And I think if we look back in all the places that we had opportunities to work together, we had several medical directors that we really enjoyed working with, and who showed us that same mutual respect and valued what we knew and our expertise, and those were good working relationships.
I agree. I agree with you. I agree 100%. So, obviously, this venture didn't last very long for us, and it was also more of a not aligning with what we believe in, and kind of shifting and changing gears a little bit, which was fine. And at that point, after that, I had an opportunity to actually go back to NAMM. At this time, I was under a different manager. I was under a different director at that point. So I loved and adored my director at the time, when she actually passed away during COVID, unfortunately. But she was an amazing human being and had given so much to healthcare, so many years, and really understood and very well knew what needed to be done and how you needed to navigate. And, as we speak, right, there's a lot of different political views in some of these. It's unbelievable to me that I didn't really think that there was that this much, especially in healthcare, when you're trying to help people, right? And I think that's just so mind-boggling for me that I just had to look at that and year after year go through, and I feel like it just got worse and worse instead of getting better for whatever reason, right? As things change. And I think most people don't also realize that even dealing with Medicare and the senior community, Medicare changes so quickly. I mean, things change so fast. You constantly, and things can change quarterly. That's how quickly they change. And this is why I wanted to be able to, I still work, because of this reason, right? To be involved in it, to still see and, be in the know and keep up with everything new that's coming out, so that I can be more helpful to people. And for me, it's just crazy, from this perspective. But she knew how to navigate that, and she knew. I was just very happy to work for a human being like that, under someone like that. And so she was an amazing human being. May she rest in peace. And but you know, obviously my manager was also very supportive at the time and wanted to make sure that I went back, obviously, and they all kind of felt the same way that I did. I didn't have the support that I needed, and they knew that wasn't. It was just not sustainable. I just could not continue doing that. It was basically I would just be burnt out and just would not be able to work anymore. So I think we know what our strengths are, and I mean I can handle a lot, and I can handle a lot, but but that was just not long term sustainable, and I realized that wasn't for me. And so yeah, so I went back in a different region. At this point, we had my manager and two supervisors. It was myself and my partner, who was overseeing the utilization management, and I was seeing the concurrent review side, which was basically more of the inpatient, the hospitals. So I was managing at the time. I was managing Temecula Valley Hospital, Rancho Springs, Loma Linda Murrieta, Menifee Hemet, Inland Valley. So those are all of the hospitals that I would oversee. And so, and they all had their own nurses there. So I would run the meetings, our rounds with the medical directors. And so, and some of the doctors, some of the physicians that we had in our hospitals, some of them were contracted providers, and then some of them were actually employed by us. So it just depends on which hospital it was. So, but it was a great collaboration. I mean, we worked very closely together. The doctors were great. I really didn't have any issues with any of them. It was a great collaboration. So, and then I was actually I was still continuing to do UMCs for, I want to say it was for two groups. It wasn't for all of it because my manager would do the rest. So, and we had total of, I want to say 5 or 6 medical groups at the time. So yeah, and I was doing for two of them. And, just continued having UMC meetings, presenting cases and things like that. So still continued doing that. And then still continuing doing manager meetings, obviously, and staff meetings. We always had staff meetings, and just, kind of touching base. And I always wanted to make sure that the employees knew they were being supported and that we all worked together. We all had open door policy. Our doors were always open. They could come in anytime if they had any questions, any concerns. I just feel like as a team, we're stronger. It's not about our roles that defines us. It's about us coming together because of how many people we have to take care of. This isn't about my job and your job. This is about, even though in the background, the patient is not, we're not directly, obviously, we talked about this as well. We're not directly helping them or, contact per se, seeing them and providing direct care, but we're on the backside providing care still, right? So I always wanted to make sure that we were on top of our timelines and making sure that we weren't out of turnaround times, when we were reviewing for utilization management. And I think that's another thing that people don't realize when we talk about these referrals, right? Like we talked about in St. Joseph's being, 40 to 60,000 referrals a month. People, I think, don't realize the volume that we're dealing with. And to try to, stay within those turnaround times that it takes, 14 days for the seniors for us to be turning those things around. And, obviously for a commercial line of business, it's usually 5 business days. And so, but we also have short-term timelines, right? Anything that comes urgent, which a lot of people, oh, if I forgot to submit this referral from a doctor's office and I'm submitting it right now, that means that it needs to be urgent because I forgot it. No, not necessarily. That's not how this works, right? But try to educate consistently with the physicians, and having our provider relations, right? Always trying to educate, trying to, find new ways. It was just really, really challenging to try to, it's like turning a ship every single time.
Mm-hmm.
It was just impossible. But I think those were mainly what I kind of was part of and doing. But obviously, in the middle of all this, we went through a transition where Optum, United Health Group, bought NAMM out. And so it was a few years before that transition happening. We were going through, all the different contractual differences and, all of these things that we had to go through. And I think that it was a lot. It was a lot for everyone. Our reviews, our yearly reviews for our employees, for us. Um, it was almost like everything that was changing, they were basically telling us that, oh, it's Optum, right? It's Optum now. So, even though we hadn't even really changed systems yet, they hadn't even taken over. Yes, there was meetings happening. Yes, we were meeting with them. Um, but it was just an interesting time, the way that whole transition happened. And to me, I feel like it was a little bit chaotic, but at the same time, you really just try to focus and stay in the today, right? And you try to keep a lot of your employees' morale higher because of all the, what we have to remember too is a lot of these coordinators or even the nurses had been there for 20 some odd years, and imagine all of a sudden changing all of that and going into a completely different direction. And, the systems were going to be completely different. They weren't used to any of that. So it was a really, really interesting time. And we started doing some pilot programs. With Scan Health Plan. We were managing some of their patients, which was an amazing program. I thought it was great because they were actually being managed by our team and their team. So we were actually collaborating, making sure that their social workers, they hired a team that their social workers would go to the homes and make sure that the patient had everything that they needed from a social perspective, transportation, housing, meals, whatever the case may be, care at home, durable medical equipment. They would also go to their physician appointments just to make sure that the physicians were on the same page with the patient and the patient was understanding what was going on, and so and everything else that they needed, whether it was authorizations or anything like that, it was mainly me that was handling a lot of that. They would just contact me, and then we would have meetings and talk about these patients. What we're planning on doing, what the goals are, and how are we going to be making sure that we execute them. So those are some of the things that I think was great that we did.
And I think because Scan's focus they only have senior membership, social determinants, um, how seniors live. I think that always never ceases to amaze us. They're on fixed incomes, and the service area that you were responsible for taking care of. Some of these places were very remote. So getting care, they had to drive a distance. And if they weren't driving or they were bedbound, and just really mapping out what that looked like. So partnering with a health plan like Scan, I can see what a huge benefit that is when you bring all the resources to the table to help a population of people who need more looking after. It, it
Absolutely.
it still astounds me how many seniors may just live alone
Yeah.
and don't have any plan as to what's going to happen if something happens to them. How are they going to get care, or are they driving, and can they see well, and how are they getting their medication? So there's lots of factors to consider when it comes to the seniors.
No, absolutely. Yeah. And so it was an amazing program. It got canceled by Optum. I guess Optum didn't think that it was really making an impact. Um, so that kind of ended there. But we also had, different programs that I was part of as well. Like we had the home care program, which was basically we were working with Charter and Destiny and Wound Tech Company, that we were having a lot of our wounds that were kind of complex, for them to handle those in the home. And obviously we had mom's meals and helping hands for the meals, for the seniors, and also the ambulatory care management monitoring system that they had for that they were basically overseeing after patients were discharging from the hospitals. They had monitoring systems where they were monitoring their vitals and things like that,
Remotely.
remotely. Yeah,
Yeah.
exactly. So those were parts of some of those we would kind of go over, even with the Charter program and the Destiny program. I ran those rounds for a short period of time, making sure that the case managers on what who were working for these companies were understanding what we were exactly looking for, and not just, yes, I get to go visit a patient and this is what I'm reporting, but it's really about what we're looking for. What are we trying to really accomplish by going into the homes? And so there was just a lot of dialogue and back and forth of our expectation. This is what we're needing to find out, right? So I think that was I think it could have been better. But again, I think it just goes back to understanding and knowing how these programs should impact, for them to be able to train their staff, right, on how what is their role, really, right? And I think it goes back to leadership again, right? It's how we understand it and what that's supposed to impact, and then how do we train our staff, right? um, so I think those were some of the challenges that I think that we were having.
And I think, correct me if I'm wrong, how did these programs and the intersection of COVID and the pandemic collide? Because did you have those programs before and then the pandemic hit, or were these things born out of as a result of needing extra help and getting people in the homes?
No, this was prior to pandemic. It was prior to pandemic, and what they were trying to do was take care of a lot of the patients in the homes. So basically, if a patient ended up in the hospital, they would discharge them, and then what they basically looked at a score, like a score system, where it's basically the patient's diagnosis, right? So based on their diagnosis, they score a number. It's called a LACE score. So that LACE score is basically, once they leave the hospital, that's how the score is basically created based on the diagnosis. So when they went home, we would actually try to schedule them, we would refer them to these companies, and then they would try to see the patients within 72-hour time frame. And then they realized that the 72-hour time frame wasn't really working that well, because people were still being readmitted. So but they were really trying to, with these programs, really trying to manage the patient's care in the home as much as possible. So, but because of the readmissions, they decided, well, maybe, we need to see them, because whatever happens, right? After the discharge is within 24 hours. That's really like the critical time. And so then they changed it to where we would see them within 24 hours. And so, but I think that even that wasn't really, I just felt like it was always, we were chasing it on the back end instead of it getting in front of it. So I think those were some of the challenges, right? So instead of us trying to set everything up, we were just like, okay, well, let's, try to go through this race of let's just see how we can put a band-aid on this and not make this bleed and not do this, or you know what I mean? So I
Yeah.
think a lot of that was from stemming from that, basically, for me, in my opinion, from what I was seeing. So yeah.
Trying to impact our high risk patients. And I think it brings up different questions and different things to discuss, because everyone gets to decide how they want to live and how care looks for them, or it definitely is the driver of decision making. And so when our health fails us, we may be in some denial about our health failing us, but we still get the right to decide what care happens for us. And so we can do a lot of band-aids and we can do a lot of things, but sometimes what you can't supplement, or you can't exchange that for building relationships with people, so that we learn more about them and how to honor their wishes and what does that look like for them, and how do we set them up for success in that.
Absolutely. And I think that, as we've learned, and, as we see this, and we've been in this for many, many, many years, um, you don't ever want to take away their independence. We all know that. But having those conversations early on, and having them understand what that looks like and what their limitations are, I think is what is the biggest thing, right? And I think more than ever, I would see more and more families basically bringing their loved ones to the hospital and saying that it's your problem now. Whatever you decide to do, it's your problem now. And I think that it was heartbreaking for me. It was just like, how can you do this to your loved one? And I realized that it might be a relationship thing, right? It just depends on what type of relationship they had with their loved one, right? Because there was just a lot of different dynamics, family dynamics that we would encounter, right? But at the same time, a lot of them just couldn't. They just could not take care of their loved ones, right? They just did not have the financial means to be able to care for them. And this is the reason why, that one of the other reasons why, is that we want to help a lot of these families get ready for that. There's so many things that they can start early on, right? But people don't know. You don't know what to do if you don't know, right? So understanding that and educating and providing that knowledge is really what I want to be able to I want to be able to do in a larger scale, right? Because I'm only one person. I can only educate so many. You can only educate so many. We've talked about this. So I think that that was one of the biggest things that, I realized that it needs to be done in a bigger way, and of course, we had our social workers and our case management team combining with us to try to, tackle a lot of our other patients, that we were trying to manage. But again, I mean, the numbers, the ratios, it was just impossible. When you have, as a case manager, 200 patients, there's just no way that you're actually caring for those people. There's just no way, And so I think that people leadership really needs to understand, and you have to choose. If you're wanting all these things, you want you want to provide good care, you want to provide um, everything to the patient, you want to have good feedback, and take care of them, making sure they're not coming back to the hospital and getting readmitted. The most important thing that you could do is really look at the quality of things instead of quantity of things. I've been saying this for at least 10 years of my career, when they would tell me, well, we just need this many numbers. And I was like, well, absolutely. Do you want quality or do you want quantity? Which one is it? You have to choose. And once it became quantity, then I was gone. Because there's just no way that I could provide the type of care that I wanted to provide in a quantity form. There's just no way. You just can't. It's just impossible. Um, to do it right, you have to take your time and make sure that you can reach everyone. And that was kind of, in a nutshell, what I did at Optum. And then I got laid off. First time in my lifetime, I got laid off. And it was majority of supervisors, some really high leadership. I think I want to say 25% were laid off, due to obviously the transitioning and, um, them purchasing and just trimming, right? And so, they really put on a lot on other people. It was a very lean, very limited number of people doing a lot of work. Um, and on top of that, they were transitioning systems. And it was interesting because I was on vacation, and they had a emergent meeting with me, and so and honestly, it was a blessing for me, because I'm in a better place for it. And so I think everything happens for a reason. I very wholeheartedly believe that. I think everything happens for a reason, and I know that there's better, bigger things, because I know that I want to be doing better, bigger things and impacting in a bigger way. So
I think too, I agree with you. I mean, things do happen for a reason for us to facilitate something else. But I think what we can't overlook is the fact that when companies who provide healthcare cut a percentage of staffing when the patients already outnumber you, that still felt, it's like a ripple effect. And so that then um, creates a whole nother situation. So while those decisions are made, money is saved in one area, it also puts more stress on the people that remain behind, and their roles and responsibilities change and grow. And as individuals, there's only so much we can do in a day. And I think we've seen that throughout healthcare, especially during the pandemic. Healthcare workers really felt the burden of that over time, and we're still seeing it. And again, ultimately, that ripple effect ends up making its way back to the patients. How do patients get help? We've mentioned this to each other, and to other people. Everybody needs to know a nurse and a doctor. You need to have somebody in your family, a friend, a neighbor, somebody who knows something about something, because as healthcare, people in healthcare, the numbers start to get smaller. Um, how are people going to get help? How does that look? What will happen?
absolutely. Yeah, no, I think that I always think about that. My skill set, wherever I go, I'll find something, right? I'm not worried about that part. And what was heartbreaking is what those patients were going to be doing. And because Optum is so big now and they have bought out so many different medical groups and they're so large, and as we know it, there was a recent situation with them as well, and they are in some heat as well, right? I'm sure people know, it's everywhere. I'm sure they've read about it, right? And so I think that I was worried about those lives, those patients, right? I mean, I get to do, for me, it's I get to do this here now, right where I'm at. But it was just so sad to see that those patients were going to be without the care that they needed. And I mean, adding all that to one person, one individual. And I think what people don't realize is that, and I can't stress this enough because I do it 7 days a week now, is that healthcare workers get burned out. There's only so much on a daily basis that we can take to hear people being sick, to try to help with however you can, but hitting your head on the wall every single day. I don't know how many times a day, because you cannot move something forward. It's the most frustrating thing. At the end of your shift, at the end of your time when it's up, your 8 hours, your mind is about to blow up because you're just so stressed out with things that you cannot do because your hands are tied, or things that you just don't have access to, that you can help. And you hear these things over and over and over and over. And that's what's frustrating. And I think healthcare workers don't get enough credit. And I think that they're amazing at what they do on a daily basis, because it's not an easy thing to go through that every day. And I think that's why I also want to empower a lot of the healthcare workers, right? I think that we are problem solvers. I think what people don't a lot of times look at is that the nurses that are at bedside, they're really the care provider, because the doctor only comes to round once a day, 5 minutes, right? The rest of the time, whatever happens, that patient crashes, that patient codes, that patient, whatever happens, that nurse is there to provide that care. And so to me, I feel like we are problem solvers. We are the ones that react when needed. We're the ones that provide that care when it needs to happen. So for us, being as creative as we are and as strong and powerful as we are to be helping someone with their life, there's so much we can do, and the sky's the limit. And so that's why I hope that I'm a voice for a lot of them to really impact in a bigger way that we can, instead of just the small way that we do right now. And I think that a lot of them just don't know how. They don't know where to go. They don't know what to do. And a lot of them, there's a lot of healthcare providers now that are doing a lot of different things. And I'm so excited and happy to see that. But I think there's more of us that needs to happen. We need to come together as a unit and come up with something amazing. And I think that that's really what I'm really going for ultimately, right? And so that's why I think that as much as I know, I can impact and do so much. And that's really why I'm here doing this, and whatever other things we have coming in the future. The most fun way to watch us is on YouTube, so be sure to like and subscribe. Also, you can follow me on Instagram, Facebook, LinkedIn, and listen on Apple and Spotify as well. If you would like to learn more about a specific topic, please reach out to us by email. You can find all this information below in the show notes.